Much question number 2.
My staff, when I was going through this question and putting these answers together, and they're very sophisticated, only one had any idea about this particular syndrome. And we've been back and forth in recent weeks about genetics and then how family members have to be tested. We've talked about Angelina Jolie, I remember a few weeks ago, and the lady a couple of weeks ago with the diffuse gastric cancer is 23 years old and how to handle that. So listen to this one. This is a follow-up of a new thing that was stimulated by the question we had last week about the diffuse gastric cancer. You talked about stomach cancer and gene tests last week. My sister is 22 years old and has been diagnosed with TP53 gene mutation and something called Li Fraumeni Syndrome. Whew, aren't you glad I didn't ask you to pronounce that one?
Sounds French to me.
Actually, it was 2 Americans, to be honest with you, that found this. She has had early stage breast cancer. Okay, one more time. She's 22 years old.
Yeah.
Early stage breast cancer, and she had both of her breasts removed. Angelina Jolie type thing. She is being seen by a cancer genetics counselor. Well, that's absolutely appropriate, 22-year-old with cancer, at one of the big cancer centers, but we live in the mountains. Okay, they are up here somewhere. She insists that I and all of our brothers and sisters and my mother, who is living, get gene tested. We know very little about our father. So that's a broken family when these people were kids. But he had some sort of a muscle cancer. Now, that's not very common, and that's about the only thing they know about him. And his mother died of some sort of cancer in her abdomen or female parts. So there's an aunt.
There's cancer all over that family.
But there's an aunt or a grandmother or somebody around here who knows a little bit about Dad's family. And, maybe Dad went off to prison or went off to war, but we don't know. But there's some lack of communication with the family, but there's enough information there to know that something's not quite right with that family. That's about all you can say, right?
Right.
Okay. The gene counselor says that my sister's gene studies are not actionable. Now, so here she's got a cancer. She's got a TP53 gene, but her genes are not actionable. What in the world does that mean? Now, they're asking the person to get tested. The sister's got cancer at 22, but her genes are not actionable. Well, I'm not going to be able to really answer that question where everybody's going to understand it. But when we just got through talking about the BRAF, I showed you that there are about 100 different BRAF genetic modifications, but only a handful of them are associated with the colon cancer, lung cancer, and melanoma. Squeaky wheels get the grease, and that's the reason that there's so much research, say, for breast cancer and so little for prostate cancer. I repeatedly say that women are more vocal about their health issues and they lobby Congress better than men who keep their mouth shut. So put the next one up.
The mile-high picture is the sister saying, I have a relative with young breast cancer. Do I need to be worried?
Yeah, that's it. Okay, now here. There is, what's that tell you? There is a support group and a total foundation, pull that down, for people that have this disorder. And I always encourage the participation in a rheumatologic group or a cancer support group or whatever, because you're going to get good information from that place there, and most physicians are not going to have the foggiest idea about this condition. Because remember now, my oncology cancer office, this particular syndrome wasn't commonly understood, known, but everything about it is. They just didn't recognize that there's a group of these people out there that have a group together. So put this up here. This is kind of easy. So this syndrome, you must have a proband. That means somebody in your family with a sarcoma diagnosed before the age of 45. Well, we don't know about the father, but he had a muscle tumor.
Could very well have been a sarcoma.
A first-degree relative with any cancer before the age of 45. So remember now, this guy with a melanoma was 50. He wouldn't have met that group. Well, this is a girl who's 22 who's got breast cancer. Or a first or second degree relative, that means a sister or brother, that with any cancer before the age of 45 or a sarcoma at any age. So we know that the father had a sarcoma at some age. Okay, pull that one down. So that's basically the group of people that should be concerned that is met by this question. So now we're going to put this next one up. Everybody takes some sort of, I'm going to ask this question. Do they still take some sort of genetics in high school where you learn about?
Probably not.
About your brown eyes and blue eyes and stuff? Okay, a little bit. So this is like, you've got a brown-eyed mother and a brown-eyed father with a blue-eyed child, and they say, oh, so that ain't right. But can that be right? Yeah, it can be right because you got two genes. So this is basically the story. This is an autosomal dominant gene, so that means that if you have a brown-eyed gene and a blue-eyed gene and you pass that brown-eyed gene to a kid, it's going to be brown-eyed. Does that make sense? Now, if you have, there are genes that are not dominant and are overburdened by the others. So pull that one down. So that is, so if you got a parent with one of them who has it, then you're going to have, this is going to tell you what the genetics are. If this one has one, you got 4 kids, only 2 are going to carry the gene. So which 2 is it going to be? We don't know. That's why you want to test everybody.
Well, wait a minute. Wait a minute. You're getting into the weeds here. You're getting into the spring of the clock or the watch. So I got to pull you out of the fire.
Please.
The bottom line is that this lady's writing in. She says, my sister at a young age has a terrible cancer. Do I need to get tested? And you've answered the question that that organization has feathered out there. There are multiple cancers in this family close enough to each other that yes, you should get screened. Had they not met those criteria, that those multiple members had cancers, the answer would have been, no, you don't need to be screened and you should not be spending the rest of your life worrying about this.
Absolutely.
Because you would like them to not worry and not go to sleep every night thinking, did I do the wrong thing by not getting tested?
That's right. And I'm going to come to that in a minute. You just Ray hit the practical matter. Everybody who has a family member with cancer doesn't have to go Chicken Little on us, because this syndrome is not terribly common. All right,
we're going to rename this Dr. Fauci on us, but
all right, this is good. All right, put up the next one. Ray and I are very used to seeing these, and you got it up there. And most people aren't, but this is what is done by genetic counselors. Okay. So all you're really going to do, you're going to look through here, way down here. So we're talking about that's the father and the grandmother, right? So that's the 2 generations above this set of people down here who are at the age of this patient. So they would construct this. They would construct this is a mother and a father, and they had 3 kids. And this kid here had gastric cancer and died, and married this woman and had 2 kids, one of whom had gastric cancer and is alive. But when you've plotted this together and you see how many had malignancy and don't have malignancy, you can pull that down. Then you have several pieces of information there. 1, that's exactly the pattern that this type of gene would do. But 2, that's an actionable gene mutation, because that gene mutation in that family is associated with activating a cancer. Put up the next one. We're talking briefly about this TP53 gene. you're going to learn in a few minutes that this gene has things to do with whether you do or don't respond. Pull that down so nobody focuses their attention on it. This gene has to do with whether you do or do not have a beneficial response to taking Lipitor for your cholesterol. This gene has things to do with hundreds of biological activities, deactivating poisons in your blood, metabolizing phenobarbital, all sorts of stuff. It got nothing to do with cancer. So the gene is everywhere in everybody's body doing lots of good work. It's helping you keep your cholesterol down when you take a statin drug. It's helping you metabolize food and stuff. So,
and with some of these genes that we're looking at and we're able to identify, you can draw them out of a patient and say which kind of medicines are effective or ineffective.
Correct, exactly, 100%. But the other point is that when you go do one of these 23andMe or one of these gene tests you do at home, and it comes back and says you got a TP53 gene mutation, and you go to Dr. Google, it's going to scare the world out of you, because when you start looking about these malignancies here, this is one TP53 gene mutation when there's hundreds of them, and it doesn't tell you which ones are, what was the word this one said here? That the genetics said were not actionable. Not actionable. But this girl's got cancer. This not actionable. That doesn't mean that the others in the family are not actionable or actionable. You have to put together that genetic
the whole picture
tree before you're going to know whether this is related to it or not. Does that make sense? Because you got 200 people who are drinking and driving, and only one's going to have a wreck, right? Okay, now put up the next one. So one more time, we got to flip back. Do you need to have this test? Yes, you do, because at the bottom it says one or more of your family members have been diagnosed with a cancer below the age of 45. So this, put up the next one now, because this is what do you call that? That's a waterfall plot, isn't it? Okay, this is the incidence of TP53 mutations in various cancers. So just quickly look, it says lung cancer, 70% of lung cancers have a TP53 gene mutation in them. That doesn't say that nobody has even mentioned lung cancer in this syndrome, have they? What's the percentage of breast cancer that has it? 20, stomach, 40. Colon, 60, pull that down. So that gene is everywhere. It's mutated in all of these malignancies, but it probably had nothing to do with that cancer being formed in the first place. Does that make sense?
Clear as mud. Clear as mud.
Okay.
Okay.
Now, there's a difference between, I told you a few weeks ago when we talked about that gastric cancer one, between you having the mutation in your blood going around or in the tumor. Because remember, you've got ovaries and testicles. The DNA comes together, you make a child, so you could have a gene that's present in your genetic makeup, or you can have a gene mutation that occurs in a cell in your body that makes a cancer start, and they're two different things. You still with me?
Yes.
Skip over the next one. I think we're going to just get over the next one. I know we're going to.
You got some eyes glazing over here.
That's going to be too complicated. All right, so put this one back up, because they put the next one up. That's the one that's got the. Here is our little P53 gene right here, right? But this now is talking about your cholesterol, your blood sugar, how you operate with statins, how you absorb stuff from the stomach down in here. Pull that one down. But anyway, that P53 gene is out there in everybody. Still with me?
Yes.
So now, how are you going to follow those patients? So we're not going to put that next one up either. That's going to again confuse BKP. So go down to the last one here, which is the surveillance slide. If this patient's family has testing and they determine from that rat that these malignancies are of a pattern that makes it actionable, meaning it could cause cancer in you, then you're going to, and I sent this to Ray, this is too complicated, but it's up there. You begin
an intense screening.
Okay,
thing
now we
for the
talk
rest
about
of your life.
mammograms beginning at age 40 and colonoscopies beginning at age 50. So I'm just going to say, what age does this start at?
Birth.
Birth. So if you have a gene at birth, you begin to inspect the skin of a kid. All right, and how often you do it for every 6 months, and you stop at this point in time. And here's this. Since this lady began with breast cancer, and breast is very common, you begin breast cancer screening at age
18.
18. The youngest advanced breast cancer patient that I ever had was in 1972, and she was one of the what you call road groupies with a group called the Allman Brothers, and she had cancer at 18. Now we know now she'd had probably a triple negative cancer, and it would have been something. We didn't know anything about that in those days. But anyway, so at age 18, you start screening regularly with the breast. Now there's all kinds of new ones. There's a digital one, and then there's this and that. We won't get into that. But you also start doing colonoscopies, and you do colonoscopies beginning at age
18.
Now we've been talking, pull that down now. So here we are, we're talking about mammography at 18, and colonoscopy at 18, and skin inspection at birth. So if you got that gene, then
and that pattern,
and that's actionable.
yeah, you've got that gene and that pattern in the family,
then
you go into an intensive screening routine for the rest of your life, and not just routine mammography, MRI mammography, colonoscopies that are not just chemical colonoscopies. I mean, that's the beauty of the genetics here, is that now you can start pulling out families or sets of families and tailor their screening so that you're optimizing how soon you can pick things up.
Okay, now I want you to go into this, because this is your field anyway. You're a diabetic doctor.
Yeah.
Now, go through the quickly in your head for us. You got, 2 or 3 people in your family with type 1 diabetes, type 2 diabetes. I mean, that's a...
Well, you've got, I want to stay with the question here. You can get into the weeds with the genetics testing. You can do 23andMe, and you can stay constantly worried about things all the time. Or you can say, you know what set of genes do I have that make me look in my near relatives and to see what they have that would possibly put me into an advanced screening program, versus being able to rest at night and not worry about it. I have in my family a child who has a set of genes like this, and she goes through special screening routines that are tailored to her genetic makeup. And this is happening more and more. I mean, this is new to our medical world, and it's rapidly changing.
But a guy like Ray takes a family history, and when a guy says, my father had a heart attack at 48, my brother had a heart attack at 56, I mean, his worry, the doctor's worry thing clicks up. So is that hypertension? Is that cholesterol? Is that diabetes? Is it random luck? No, it's not random luck when it's been that many patients. So this is not just cancer. This is everything about the relationship that you have with some healthcare professional you trust that you're going to go talk to. Now, both of these questions are asking, do I follow the advice of people that I trust, or I'm supposed to trust, on what I'm supposed to do? And the answer to that is yes, get tested.
I think the interesting philosophical thing about this, Bill, as you're saying that, is that to the degree that you can tailor the screening to the family and be intensive where you need to be intensive and relax where you can relax, you are much more dialed in to being helpful. Because when you just tell everybody that they all got to screen the same way, the same amount, then you're going to get a lot of people saying, well, I spend a lot of time and money and effort worrying about nothing.
Yeah, exactly.
We'd like them to not worry about nothing. We'd like them to relax on the nothings, and we'd like them to pay attention to the stuff they need to pay attention to.
In the interest of time, I know. Well, I do have a question on
All right,
this.
go.
Because you started out today and you talked about the progress, the great progress through genetics. Okay, we've discussed that over and over, and we start out that you say, well, we don't know much about Dad. There's right now there's a lot of, I'd say, controversy or people concerned, should I give my DNA up? But, you know, there's a lot of people that are like, well, wait a minute, I don't know if I want to be in a database. But this particular question on the second one here, I know of a situation where somebody did a 23andMe and it genetically bounced back to somebody else, which the individual found her father. Okay?
Yeah.
And the mother just said, you know, it was a military guy that came through town, and no joke, you know, basically a military guy that I had a relationship with, and the lady never knew her father. Well, I'm not saying it, you know, through medical, but now she can get the data and the background for her children, her grandchildren. I mean, is this?
Well,
is this a good thing? Is it becoming a good, useful tool for research?
3 ways to look at it. One, 2 days ago, they found that they indicted a guy for a murder from 1970 something because they had DNA off of a sandal, and this guy got his swab when he got arrested for something else in the state.
They pulled the bench.
And they pulled it back up, and this big computer in the sky links this guy in California to a 1990-something speeding ticket that gets him to a 1972 murder using exactly the same technology. Here's where I think it's good, and here's why I'm in the database. I spoke about the liver transplants a few weeks ago of unrelated donors that are well matched, and the bone marrow transplantation. If she has leukemia or her child has leukemia, and they need a bone marrow donor, there's no family member that matches, and then they go into the great computer at Hanover, New Hampshire, Dartmouth, by the way, there may be some guy in France who's put his DNA in there who's a perfect match. And all he has to do is go to the hospital in Paris, donate his stem cells, freeze them, fly them over here to Atlanta and give them and save their life. So that is the great thing that can happen by having your genetics and your information in a database somewhere. Now the opposite side is, you can give up some freedom and
but knowing, I'll just put it like this: knowing mom and dad, we discussed this morning. Knowing mom and dad and having the genetic makeup, we get an understanding of why your eyes are blue. We're at the point of, we've surpassed that, obviously, that with the genetic makeup and the research, we're curing some cancer.
Absolutely.
We're changing things.
We're directing therapies and making cures.
Right.
But we're also picking up earlier. I mean, that's the whole point of these set of questions. Are we able to screen pick up early? I want to throw you a really interesting.
So is there a way to safeguard your data? Because you get the people like...
Yeah, that's a whole social, political issue. I want to throw out a really cool case you've brought to my mind. I know of a family where they did the 23andMe thing, the ancestry thing, and it came out that one layer of the family, the children looking into that family, their father was not their father. Now that's a big, and he's dead. Their father who raised them is not their father, and he's dead. And they're like, Mom, what's going on here? Well, interestingly, the mother said, Dad was impotent. He was not able to have children. And we had artificial insemination.
Sperm donor,
we had sperm donors. And had they had mother passed and they found
infertile.
that infertile, I'm
There
sorry,
you go.
well, bad word.
Yeah, all right.
But had they not asked why mother was alive, they would have never gotten that answer.
All right, I got a question for next week. Is the pandemic over? I don't know.
Cancer death rates.
Oh, cancer death rates continue to fall. Research report.
That's
Your
all-
first one, you just pointed there. It
Well,
said, "Is
okay,
the
that's-
pandemic over?"
Okay, that's today's
It's
news.
over.
This was released yesterday, and that's exactly what we're talking about here, though, about the genetics. Cancer death rates are falling
Yes.
because of detection by genetics and genetics treatment, not by more surgery. Go
I
ahead.
will
Your
not
turn.
ask you if the pandemic is over. It's well after 9:00, so you can answer that later. Here's my question I want to answer next week. Okay? How severe? I want you to tell me a little bit about strokes. How severe when you hear mini stroke, but if you have a severe stroke, what is the recovery time? And having that stroke, what's the odds of having another
Okay,
one?
That's almost impossible to answer. I had a mini stroke 20 years ago from atrial fibrillation. As it recurred, I'm on anticoagulants.
Okay.
Now, if you have a cerebral artery embolus or thrombosis on one side, you're going to be hemiparalyzed on the other, and if it is a spastic thing, you may begin to get better in a few hours. If you immediately get to the ER and get clot buster, it may dissolve, and within 2 weeks you're normal. And if it goes to completion, you can be paralyzed for the rest of your life.
My grandmother had 3,
Okay.
and all of them were much more intense. And all of them took a period of time for her to come back to recognizing who we are.
Okay.
And what I'm saying there is hospitalization. When you have a stroke, that your hospital, it's. I mean, I am so much trouble with your office. You're late for work.
All right, we can talk about it next week.
You understand where
All
I'm going?
Yeah.
Yep.
Okay.
Okay.
Turn the
Are
heater
you?
on.
Do you
Would
need a
turn the frickin' heater
campfire?
on?
Do you need a campfire?
I need a campfire next
We should have done this.
I'm hanging
with
in here. I'll bring in a
camp-
blanket next
I
week.
can't believe we didn't do this around a fire
Next
pit.
week, though, will be November. I mean,
And we have
October.
them sitting in metal chairs.
October.
Let's go.
All right.
Ask the doc. See you later. Right back after this with the All-Star Political Panel.